Evening, everybody. I'm Dr. Firoz Muhammad Khan, consultant urologist and renal transplant surgeon working at Sahara Hospital, Lucknow. As we all know that this is September month, a month of National Prostate Awareness. And now today I'm going to talk to you regarding the prostate health and the various problems associated with the prostate. So I did my MBBS and post graduation from JN Medical College, Aligarh, and MCH from CMC Vellore, Tamil Nadu. Now coming to the prostate gland, and the common problem associated with it is benign prostatic hyperplasia. So this is the anatomy of the prostate gland, where it is located. So it is a small size gland which is just located below the urinary bladder and anterior to the rectum, that is from where the stool comes out, and it encircles the prostate gland encircles the normal urine passage. So when a person ages, this prostate gland increases in size, and when it increases in size, it compresses the urine passage, and because of that, various urinary problems starts. So here you can easily see in this picture, this is a normal prostate gland. Here is the urinary bladder. And when this prostate gland is increasing, it is causing the narrowing of this urine passage. And because of that, bladder has to apply more pressure to pass urine. So this wall becomes thicker, and various irregularities you can see. And but because of prolonged stasis of urine, bladder becomes weak gradually, so the urine starts retaining in the bladder. So prostate gland is a walnut size shaped gland which forms the male part of urinary system and is located just below the bladder, as I discussed. And it produces a secretion which is the composition of the semen, and it helps in the viability and the transformation of the sperms. So coming to the benign prostatic enlargement, fortunately it is a benign, it is non-malignant disease, but it does not cause cancer also. That is a very common myth among the people, that prostatic enlargement causes cancer. So that is not the case here. It does not cause of the cancer, and it also does not lead to cancer. But the benign prostatic enlargement can coexist with the prostate cancer also in the same patients. So, and there is no initial stages, there is no sign and symptoms with which we can differentiate between the benign and the malignant conditions. So that is why when a patient comes with the problem of BPH, we have to rule out the prostate cancer also. So this is the enlargement of the prostate gland. This prostate gland actually, during the early stages of the life, it is very small in size, and it grows during a whole period of time life in two phases. One, spurts of growth occurs at the time of puberty, when the prostate becomes double in size, and the second phase of the growth spurts comes at the age of 25 years of age, and that goes on for most of the rest of the life. And that is the second phase of this growth spurt in the prostate, which leads to prostatic enlargement. So as the prostate, as I already discussed, is when it grows in size, it presses the urethra, and the bladder wall becomes thicker, and because of that, the various urinary symptoms starts coming. So before the age of 40 years, BPH is not common below age of 40. And during 50 to 60 years of age, about 50% of the patients, they have symptoms of benign prostatic enlargement, or you can say lower indirect symptoms. So it is there in the milder form or maybe moderate form in 50% of the patients. As the age increases, this prostatic symptoms starts increasing in incidence, and it has been seen that it is present in 90% of men who are over the age of 80 years. So when the prostate enlarges, the layers of the tissues surrounding the prostate, it stops it from expanding. So what happens when it is not expanding outside? It starts compressing to the lumen of the urine passage, and which works as a clamp on a garden hose, and the urinary symptoms starts coming. So what is the exact cause? As we don't know what is the exact reason of the prostatic enlargement, but it has been seen that in reproductive life of men, there is a large amount of testosterone, which is a male hormone, and the estrogen also being secreted by male, which is in a very small amount. So as the men ages, the amount of testosterone starts decreasing, and the level of estrogen, either it remains same or it is sometimes it is increased also, which leads to the growth of the prostate gland. These are the common symptoms and signs of the enlargement of prostate. Among them, one is the weak urinary stream, where the patient says that his urinary stream becomes weak. He has to, second symptom is he has to pass urine very frequently. And third, which is also a common symptom, like when they say when they go to toilet after passing urine and they comes back, there is still a dribbling of urine is there. Some few drops of urine comes out. The other symptoms are like they cannot hold a urine to pass for a long period of time. Maybe when they have this urge, they have to go to toilet immediately. Otherwise, they think that they may leak. So when this symptoms, these disease prostatic increases or duration increases, and gradually what happens, bladder becomes weak, and then this stasis of urine into the bladder, which leads to overflow incontinence sometimes. So then what happens, the bladder is filled beyond its capacity. The sphincter, which is control of urinary system, where the urine, it prevents the urine leakage, that also becomes weak and then starts urine leaking. And frequent urination at the night time also is a common symptom among the patients of benign prostatic hyperplasia. So when to a person, when he should seek a doctor's advice, these are the things, like when the urine stream is weak, when there's a difficulty in starting urination, that is called intermittent urination, or hesitancy, and the stoppage and starting of urine, that is the intermittent urination. Like when he starts passing urine, it breaks, and then he starts again and then it breaks, so that is called the intermittent urination. Or dribbling, that as I said earlier, dribbling of urine at the end of urination, frequent or urgent need to pass urine, increased urination at the time of night, and if he has to strain to pass urine, or if the person feels that he's not able to completely empty the bladder. So this is another symptom of benign prostatic enlargement. Or urinary tract infection, or formation of stones in the bladder. These are the conditions where patients should seek doctor's advice. So precise etiology is not known. Why this benign prostate enlarges, or it becomes hypertrophied. There are several risk factors associated with the BPH, and lower tract symptoms are age, genetics, hormonal factors, growth factors, inflammation, and lifestyle factors. We'll come to each of them one by one. So age is the major risk factor for benign prostatic enlargement. We all know that at the early age of life, there is no enlargement of prostate, and as the person ages, this prostate starts growing in size, and there is hypertrophic changes, and then patient starts developing symptoms. And as the incidence of the BPH and LUTS also becomes gradually increasing as the patient ages. And it has been seen, like in genetic factor, when the patient family history is there of having a benign prostatic enlargement, there is always a likely chances that he may also have the symptoms earlier in life. Sex hormones have been associated with this. Androgen is the most extensively studied hormone, and it has been seen in prostate, like testosterone, the male hormone, is being converted to dihydrotestosterone by an enzyme called 5-alpha reductase. So what happens is, this increase of the dihydrotestosterone leads to cell proliferation, increase in number of cells and differentiation, and which is causing the hypertrophy or hyperplasia of the prostate gland. Similarly, the growth factors, there are several growth factors which has been associated with it, like epidermal growth factor, fibroblast growth factor. These are the terms which is you can just you don't have to learn more about it. So coming to the inflammation, this is been suggested that inflammation closely linked to the development of BPH and lower urinary tract symptoms. The degree of inflammation is correlated with the prostatic volume and weight. And from an immunological point of view, when the inflammation is activates the release of cytokines and raises the concentration of growth factors. This is a metabolic syndrome, lifestyle factors. We all know that the metabolic syndrome includes several things, and it has been recently reviewed that metabolic syndrome is associated with benign prostatic hyperplasia. And this is that is total prostatic volume is significantly higher in obese patients and those who have a low HDL level. Like if the cholesterol level is bad, the patient is obese, then there is a chances of increase in prostatic size. Smokers, those who are having a sedentary lifestyle, and those who take a lot of proteins, they are also very likely to develop prostatic enlargement in early than the normal patients. So coming to the aging, age increases. As the age increases, the chances of benign prostatic hypertrophy also increases. This is the well-known risk factor. And the second is, as I already said, family history. If the patient is having a history that his father or his brother or his grandfather had prostate problems in his lifetime, there is very likely that the patient also had developed this problem in early life. And this has been seen that in American and Australian prostatic enlargement is common. Coming to the prevention, so there is no sure way to achieve the prevention or to achieve the BPH. They cannot prevent the prostatic enlargement, but it has been suggested that if a person try to control his weight, or if he has a very healthy and well balanced diet like rich in fruits and vegetables, so or if the patient is very active, he's not sedentary, he controls his body weight and the hormone levels are in normal range, then these are the things which you can say that it may prevent the prostatic enlargement, but it's not sure shot. But definitely weight loss, healthy lifestyle, healthy and balanced diet has a good role in the prevention of benign prostatic enlargement. The complications of enlargement of prostate are the most common or dreaded complication is acute urinary retention. A person develops suddenly develops that he is not able to pass urine, completely stoppage of urination. So this is an emergency. He has to suddenly rush to the hospital to put a catheter from urinary passage. So sudden painful inability to urine is called acute retention of urine, and it occurs while taking medications, allergic medications for common cold. That has been seen in old age population where there is a prostatic enlargement, but the patients are those who are not having much symptoms of prostate BPH, and suddenly when they start taking allergic medication for common cold, they develop acute retention. So it has been seen also that in alcohol intake and cold climate, their patients develop acute retention of urine. Another complication is urinary tract infection, which is commonly seen in patients who have a BPH, bladder stones, development of bladder stones in patients of BPH, and if there is a prolonged stasis of urine to the bladder, it causes the backflow changes to the backflow pressure of urine to the kidneys, which leads to damage to the kidneys and the bladder also. So how to diagnose? Well, first of all, the most important thing is the history. When you ask somebody what are the symptoms, how it develops, how frequently he passes urine in the night, what is the stream, and after a history, the second part is the examination. So in the examination, the focus examination of the prostate through the rectum. So this is called digital rectal examination, where a physician puts his finger into the anal or the passage of where the feces passes out. That is called anal canal, and he feels the prostate gland from there, and to assess the size of the prostate, to assess the consistency of the prostate, and the any nodule or any suspicion of prostate cancer also. Blood test, the most specific or most commonly done test is the prostate specific antigen, which is, this is an enzyme which is being produced by the prostate exclusively, and it has been used for to screen for prostate cancer. And but when PSA increases, and there are several reasons to for the PSA to increase, so we should not get worried immediately just after seeing one value of the raised PSA, because PSA can rise in different conditions like inflammation of the prostate gland, that is called prostatitis, retention of urine, and the enlargement of the prostate also, like BPH, and prostate cancer also. So once the a person is having a raised PSA, first of all, it should be doubly checked, and there are other things also to be ruled out before jumping into the saying that this patient have a prostate cancer. Coming to the rectal examination or rectal ultrasound, we can just examine the prostate from the with the help of the ultrasound probe through the rectum. That is called rectal ultrasound probe. If there is any suspicion of prostate cancer on clinical examination and raised PSA, the next investigation is biopsy to rule out the prostate cancer. And the biopsy of the prostate is being done most commonly through the rectum, through the anal passage, and where we put the ultrasound probe. Through that, there is one needle which goes into the prostate and takes some samples to assess and those tissues should be examined by a pathologist who tells about the nature of the tissue, what it is. It is a benign, or is a non-malignant, or a malignant disease. There are several other ways or other things which are not mandatory, but depending upon the severity, depending upon various other clinical features, we need to have a CT urogram. The other things which is very mandatory test during the PPH evaluation is the urine analysis, where we assess the see the RBCs, WBCs in the urine, as well as the proteins, sugars. These things should be checked. And the urine culture test, uroflowmetry, that is urine flow, it measures the strength and amount of urine to be flowed. That is called urine flow test. And after the examination, after making a diagnosis of benign prostatic enlargement, next is the treatment part. So treatment part is divided in 3 categories. First is the active surveillance, second is medications, and like the drug therapy, and the third is the surgical management. So coming to the active surveillance. So active surveillance basically is for patients who have a mild to moderate lower urinary tract symptoms, and those who are not bothered much due to BPH. So these patients put into the active surveillance group, where they come for an annual checkup to their physician, where they do basic history, physical examination, basic tests, and they're being watched for the worsening of the condition, any new sign or symptoms development, or anything which is suggestive of progression of the disease. Then immediately these patients who are in active surveillance group, they being advised for the medications. Otherwise, they remain in the active surveillance group. Coming to the next, medication group. So this is the most common form of treatment for moderate to severe symptoms. Among the medications, the first and the most commonly used drug is the alpha blockers. Alpha blockers are the drugs which acts on the bladder neck muscles to causes the relaxation of the bladder neck muscles, and also acts on the muscles fibers of the prostate itself, which causes the relaxation of the prostatic muscles, and it makes it easier for the urine to pass. The next group of medication is the 5-alpha reductase inhibitor. This drug acts on the enzyme which converts the testosterone to dihydrotestosterone. So that when this medicine given, it acts on that enzyme, and it prevents the dihydrotestosterone for formation of the dihydrotestosterone. So because dihydrotestosterone has been seen that this is associated with the increase in size of the prostate. So when there is no dihydrotestosterone or the dihydrotestosterone level is decreased, the prostate growth is stopped or it starts shrinking. So this drug 5-alpha reductase inhibitors, they helps in shrinkage of the prostate. And sometimes we have to combine these two drugs, above two drugs like alpha blockers and 5-alpha reductase inhibitors, especially when there are symptoms are very severe or the prostatic enlargement is more than 40 gram or 35 grams. So here, when these two drugs are combined, they act synergistically and have a very good results and very fast results. It helps in relaxation of the bladder neck, smooth muscles of the prostate, as well as the shrinkage of the prostate. So patients develop, the patient starts having they become symptom free very early. Next group is the anticholinergic medications, and these are the medications which are given to those patients of BPH with the lower urinary tract symptoms who have more of the storage symptoms. The storage symptoms like urgency, they cannot hold urine for a long period of time, nocturia, like frequently passing urine in the night, and the third thing, that is the urge incontinence. Like if they don't want to hold urine, then they are going to toilet, immediately they start passing urine. So these are the three conditions where we have to combine the anticholinergic medication along with the alpha blockers. Next is the phosphodiesterase inhibitor. This is another group of medication that also acts on the muscles of the prostate as well as the bladder neck, and it relaxes these muscles and increases the urine flow. This is the diagram which is showing enlarged prostate with thickened urinary bladder wall. Here, to pass urine, this because of this prostatic enlargement causing the compression or constriction of the bladder neck, and this enlarged prostate is benign. This is the benign gland which is compressing the urine passage. So what happens when the drugs are given? Here you can see in this photograph the bladder neck relaxed because of the effect of the drug on the bladder neck muscles, and similarly the prostatic muscle fibers also relax, so there is establishment of the lumen of the urethra. So this is another diagram showing the effect of alpha 1 blocker on the lumen, or the pressure is reduced, so the patient starts passing urine easily. Now third line of management is the surgery. So there are some few absolute indications for surgery of the prostate, and among them 5 are the most common, like when patient kidneys are damaged because of the back pressure changes of urine into the kidneys, causing the obstructive uropathy, like serum, the kidneys are not functioning well because of the prostatic enlargement, or if the patient starts develops a bladder stones, or if the patient is having a recurrent hematuria, like passing blood in urine very frequently, recurrent urinary tract infections, or if the patient is having a recurrent retention of urine or very refractory urine retention. These are the terms which is used by a medical person, but you can in a long common language you can say, if the patient is being, suppose the patient comes with a retention of urine, he's being catheterized, he was given medications, and after some time the catheter was removed, again the patient develops retention of urine. This is called a recurrent urination retention. So these are the 5 absolute indications for surgery. So when the patient is not improving on medications, this is another indication for surgery. Apart from these 5, those are the absolute indication, is a relative indication for surgery. So here what we do is we remove the prostate gland, and which the part of the prostate gland which is restricting the flow of urine. So urine flow becomes very good. So there are various types of surgeries available right now. Most common among them is, or the most frequently commonly done procedure is the TURP. Most of the people will be aware of this treatment. That is the transurethral resection of prostate. This is endoscopic treatment where the instrument, very thin, long instruments, goes from the urine passage, through the urine passage into the prostate area, where the special type of instruments, where those instruments we cut the prostate gland, which is causing the blockage to the urine passage and take out the small chips we take out from the urine passage. So that is the procedure called the TURP. Next is the another procedure, that is the TUIP, that is transurethral incision of prostate, where the prostate is not much enlarged, but in spite of that it is causing the blockage to the urine passage, because it is the lumen of the prostate urine passage is very narrow. So here we give incisions. We don't resect the prostate gland, but we give incisions, two incisions at the bladder neck to make it wide open, so patient feels they start passing urine easily. Another recent advancement is the laser treatment. So one of them is the HOLEP, that is holmium laser enucleation of prostate, and another is a THULEP, that is a thulium laser enucleation of prostate. Both are laser operations. The difference is that this is a holmium laser machine here is used here, and in this case the thulium fiber laser machine is used. There are slight difference or slight advantages of thulium over the holmium, which is not a topic to discuss here, but you can say, you can understand that these both of the treatments are very effective for the surgical point of view. And the most last is that is the open prostatectomy. Nowadays open prostatectomy is not being done. Most of these patients are being managed with the TURP or the holmium or thulium laser enucleation of prostate only. Open prostatectomy indications are very less and is being performed very less nowadays, not being used, not being performed in routinely. Coming to the long-term side effects, long-term side effects are not much. Most of the side effects of either medications or surgical are temporary, and these side effects also vary with the type of treatments. For sexual function, it becomes normal after some time, especially in those who have just before the surgery. If they have the normal sexual function, there is a very likely that they will develop or they will again regain the sexual function after some times of surgical intervention. The most common problem which occurs after surgery is the retrograde ejaculation. This is a term which is used for the passage of semen into the, when semen goes into the bladder rather than coming out from the urine passage to the outside. So this is called retrograde ejaculation. So that is the temporary, you can say is a temporary or it's a permanent long-term side effect of the prostate surgery. But good thing is that the patient doesn't have any decrease in desire or any kind of any other sexual dysfunction. So after some time it becomes used to. So the only thing is that there is a issue with the, if the patient is planning for a family, for a child, then it becomes an issue. Otherwise there is no much problem with that. So thank you very much. I'm going to end my talk. I'm very much thankful to the for the viewers who are there to listen to my talk, and I'm also thankful to the Reddy's Labs, which has given this opportunity to present this topic on this Prostate Awareness Month. Thank you very much. Any question? I think there is no question. Okay, so can we stop now? Okay, so there is one question. Um, One person has asked about the as soon as I drink a glass of water, I need to go for urination within 10 minutes. Is this a serious matter? First of all, uh, it is not mentioned here what is the age of the person who has asked this question, because that matters. If the patient is of old age, and if he is diabetic, we have to know each and everything about that, and then we need to evaluate if the patient, like if there is no prostatic enlargement, and he's not diabetic but the age is more, or then we have to start the anticholinergic also. In this case, we have to basically look, there are several other things also. There is one thing is that frequency volume chart, how much he drinks water, how frequently he drinks water, and how much on how what is the amount of urine which he is passing. So that is called the frequency volume chart or bladder diary that has to be maintained. And in after that we can start anticholinergic medication with the advice, other things like dietary, or you can say lifestyle modifications, that reduce the fluid intake in the evening, restrict the fluid, the coffee or tea intake. These are the things which is to be advised for the lifestyle modification apart from medications. Thank you. Any other question? Okay, thank you once again. I'm going to stop my talk.